Doctors have read it. What was your dumbest patient experience? Story 1. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a DC so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with high levels of hormones. Docs are worried because she might have some retained placenta or pituitary disorder. This could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they're going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HGC shot." Turns out that she's on the HGC diet. HGC is the pregnancy hormone. This was after an hour of the doc saying, "We don't know why you have these constant levels of HGC in your blood. We're worried." Story 2. Oh boy, it's my time to shine. 1. A guy brings his wife to the ER. Her leg has a 7 cm by 7 cm wound. Diabetic ulcer, with pus, and just looked disgusting. Now I took one look at her and referred her to the surgery department for admission, but the hubby is adamant on his wife's kidney disease. "But doc, it's just a wound. You gotta fix her kidney first, doc. I read online that diabetes can cause kidney failure, and you gotta do something for that." I spent an hour convincing him that his wife would probably die before the kidney damage sat in by sepsis from the clearly infected wound. 2. During my pediatric internship period, one day I was in charge of the general ward. Basic things: look after the kids, solve small complaints, cough, breathlessness, etc., evaluate new admissions. Now where I work, interns are supposed to draw blood from children for tests. So I went about my job and there's one little tyke who's a bit too active and jumps around when he sees the needle. The mother gives me a vile look and says, "You are just puncturing my child for your education." At which point the kid just screams even harder. Yes, I'm studying to draw blood at 2 in the morning by waking up a kid. That's what she thought. Took a fair amount of convincing too. 3. I took care of a child that got measles. The mother and father were strongly anti-vax but were yelling at me, "How can modern medicine not have a treatment for measles?" At which point I told her there was a preventive method but you didn't use it. She asked me what it was, to which I replied, "Vaccinate your child." She said, "You're just one of them pharma lobbyists, aren't you?" Yes, I am a pharma lobbyist who wants to do this for pleasure. 4. A lady comes screaming into the ER. Now she's all dressed up, so are her 2 grown daughters. All of them are screaming hysterically that their mother is going to die. I go by them and nearly get tackled by the sister-in-law, husband of one of the daughters. "Save her, she's having an embolism." Shaken, I examined the lady, asked her where she was coming from. A wedding, that explained the dress. She apparently had a bit too much of potatoes. A shot of pantoprazole later, her embolism is gone. She had a bad case of fart embolisms. One thing I will never forget is how I learned never to be mad at a patient. Now, this was when I began as an intern. A patient had intestinal obstruction. We inserted a nasal feeding tube as the patient could not have anything per-orally before the surgery. Problem was that they would always come and complain to me about how I didn't stick it properly. You have to stick the end protruding out of the nose to the nasal bridge. After 2 to 3 such episodes where I reluctantly dressed it, they complained that the tube is out of the nose. And lo and behold, it is out. It's very uncomfortable. Most patients try to pull the nasal tube out. I replaced it like 4 times. Poor guy was fed up by then. On the morning of the surgery, his wife comes and asks me, "Doc, can you just remove that tube so that I can give him some coffee?" Now, I got totally mad. I was working a 72-hour shift, so I scolded her by saying that if she or he didn't want the surgery, then I couldn't do anything, and it would be nice if they gave me some peace. She didn't say anything. The patient, 50 years old with no other complications, on the table. I couldn't face her. The moral being, doctors know more than the patients, but it's not always wise to bite their heads off. I could have convinced her it was impossible to remove the tube before surgery in a calm way. Since then, I've tried to be a better speaker to patients. When the story starts with, "It's my time to shine," you know it's going to be wild. But honestly, your stories are rough. Also, did you say fart embolisms? Hey, also, if you didn't know yet, me and a couple of my friends just launched Rufus Rugs. Premium, custom, hand-tufted rugs. Maybe you're just a fan of Naruto and want to show it off. Or maybe you just love Pokemon and want bus toys on display for everyone. Either way, we can make almost anything. So hit the first link in the description to learn more. Story 3. I'm an OR nurse and I had an oral surgery patient who had a self-reported history of 250 plus various surgical procedures, a list of 20-some allergies, tons of reported health issues, plus her preteen son supposedly had dozens of health issues as well. She refused to remove her glasses during induction, started screaming and crying about claustrophobia when we put the mask on her face. She also insisted in taking a stuffed animal to the OR. Anyway, getting to the point, she was having oral surgery because she told us, insisted, that the last time she went to the dentist, they told her not to brush her teeth for at least a year, so she hadn't brushed her teeth in like a year and a half. That was one for the books. My first thought when you said preteen son was, crap, she's already reproduced. Another thing, you should burn the mask afterwards. 1 year no brushing. The smell was probably enough to knock the dude out. Story 4. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that the puff machine gives you glaucoma and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma doesn't have any outward symptoms before you start going blind. This dude just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. Also, puff isn't that bad, guys. Try contacts. Your eyes stop fighting back pretty quick. The puff is a lot better than the old machine. It just hit you on the eyeball with a little ball and a lever. I also have plenty of patients that don't understand family history. I interview patients directly so we don't have any real paperwork, and too many people can't answer simple questions. Do you or any of your direct family members have diabetes? Yes. Yourself or your family? Alternately, if yes to family members, they start listing their spouse's family or stepchildren. Not how genetic disposition works. We're after getting no answers to diabetes, hypertension, glaucoma, thyroid problem, heart problems, etc. I ask if they take any medications. Yeah, atorvastatin, thyroidazine, metformin, and low-dose aspirin. Oh, so you have everything I asked about. Check. Want some more? Way too many people don't understand presbyopia. As you age, your lens hardens and can't focus up close anymore. Of course, when this is explained, I get a lot of people who believe they're way too young for bifocals. No, 60 is not too young for bifocals. Why doesn't the doctor have to wear bifocals? He does. He's wearing progressives. You don't see the line. We're after trying to get used to multifocal lenses for a few days, giving up and demanding we remake them as single vision, and then getting mad at me again when they can't read with them. I never needed bifocals before. Why can't you just make me regular glasses? Regular glasses always work just fine. Yeah, you used to be 20. Also, you came to see us because you can't read with your regular glasses. In the same vein, these same people complain about their own insurance to me because progressives are expensive. A line bifocal is covered entirely. Progressives cost a lot. I can't have lines in my glasses like an old person. Then you want progressives. This easily triples the bill. Why are you so expensive? I need to be able to see. Yeah, you need a bifocal, you don't need a progressive. You want a progressive. Insurance pays for what you need, not want. I actually had a guy make me talk to his insurance agent about him needing medically necessary progressives. A progressive lens is never medically necessary. Stop being cheap and listen to what I say. I'm not a salesman, I'm a medical professional. Stop acting like you know better than me. Hilarious. Puff causes glaucoma. I can't even. Hopefully the patient being a moron doesn't get passed on to his or her kids like their diabetes. Story 5. Not a doctor, but a patient whose mother was like this. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease. Very, very badly. It skipped my mother and her brother. When I was 15, over the course of 6 months, I went from being 5'9" and 190 pounds to being 110. I was a skeleton, extremely anemic and coughing a lot. My mother was convinced it was something else. It forced her to bring me to a doctor and she spatted off all these possibilities. She then talked about what she Yahoo'd, not even Googled, Yahoo, about genetics and such, and Crohn's can't skip generations. Well, the doc said, just in case we're gonna run some tests. Long story short, I have Crohn's in my throat and small intestine. So does my cousin. It just skipped a generation. To think your mother used Yahoo, that's where she went wrong. At least she didn't use Bing. Bing would have said it was terminal. Story 6. I work for an optometrist and it was the month before school started and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well-spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school, for some reason this caused the switch to flip on the mom, and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out, and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explained that he's only trying to help them, but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently, the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needed glasses. What's with people saying doctors are just trying to sell them stuff in their cons? Funny how she had to go back and get another prescription. You should have given her a lot of water too, because that's a huge pill for her to swallow. Story 7. Oh, I have 2 good ones that come to mind. Clinical pharmacist here, by the way, with one story in the ER and one in the pharmacy. 1. ER physician told me this one. 16-year-old boy presented to the ER with an extremely swollen, discolored wiener. Apparently, he has been using his mom's insulin needles to draw blood out of his arm and use it on his wiener. He thought that adding blood would help increase his size. His wiener was terribly infected and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were taking a pill each, and was adamant that was how they needed to prevent pregnancy. Well, I guess if his doc was swollen, he kinda achieved his goal. That lad is a pioneer, clearly. And regarding the boyfriend, I know he has good intentions, not so sure with reading comprehension though. So if you don't want to have a swollen doc, hit the like button and subscribe to the channel. Now back to the video. Story 8. I've got 2 stories that stick out in mind. The first is the mother of a toddler who came into emergency. The kid had cruddy green stuff coming out of his left nostril and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mom was sure he caught a sinus infection and just wanted some antibiotics. Now, I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition, but Mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until it pulled out a big old bun battery. It would have been burning his nose for a couple of days. Hopefully he healed up well. Side note, if a kid swallows a bun battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. The second story was when I was a medical student. I did an overnight ambulance ride along. It was a slow night, so I was excited when dispatch called about what sounded like a stroke or loss of consciousness. We zip over there and the paramedic knocks on the door of a darkened house. A man opens the door, slowly, and says, "Oh yes, he's in the back room." My sense of foreboding grew as we slowly made our way through the dim house, wondering what awful sight I would see back there. Just before we get to the back room, the light flickers on and this spry elderly woman practically bounces out of the room, carrying her bag of meds, cheerily saying, "Oh good. Hello gentlemen. Let's go to the dining room and I'll tell you what's been happening." She explains how she's on meds for high blood pressure, but instead of taking them as prescribed, she takes more or less depending on how she's feeling or something. Before bed, she took her BP on her home automatic machine, and it was a little high, so she kept repeating it and the numbers kept going higher and higher. She thought she was going to have a stroke, so they called 911. Of course they were going up because she was freaking out about the previously high numbers, causing a vicious circle. Even though both I and the paramedic knew she was more than likely fine, neither of us were doctors and so had to take her to the hospital for assessment. So yeah, either she didn't understand her meds in the machine properly, or she thought she was too smart to follow her doctor's instructions. Story 9. Where to start? Number 1. Picture a middle-aged man. His index finger is 5 times the size of the rest of his fingers. It smells. It's leaking pus. There's necrotic tissue. Basically one huge infected cancerous finger. He was a firm believer in not taking any sort of medication, including antibiotics or chemo. Died a few weeks later. But he did manage to tell us we were all idiots before he passed away. 2. Patient was a young child who came in with an extremely high blood glucose level. Once she was stable, we did some teaching and kept her for a few days for observation. For some reason, every time I checked her, her levels would be extremely high, although we were appropriately treating her. Turns out, her family would bring her fast food for every meal and hide it in the side table. More teaching and resources were put into place. 3. Had a mom in hysterics because she was convinced that our neighbor's, friend's, stepson's, teacher's dog is MRSA, so her baby was going to pass. It took everything within me to not tell her that most of the hospital staff have MRSA, but it took 3 hours for me to finally calm her down after I called infectious control, her pediatrician, gynecologist, and family doctor. Yes, I had to call all these people. Yes, they laughed at me. Yes, she was beside me the whole time, questioning their judgment. I love my job, but at times it makes me crazy. Oof, sheesh, yeah. I don't get the I don't want to take your meds trend, but whatever helps them sleep at night, I guess. Also, how's her neighbor's, friend's, stepson's, teacher's dog? Can I pet him? Story 10. Physical therapist here. I love the macho Hulkians who come in for shoulder pain with giant pecs and arms. No back muscles. Hand them our pink 1-pound weights and they laugh and think I'm an idiot. Make them hold a certain position for 1 minute with the weights. They want to cry because it's so hard. Also, my mother. She has an undiagnosed hypermobility syndrome. She's 65 and can easily place her hands flat on the floor when standing. She also has intermittent back pain. Hypermobility plus pain equals stability and strengthening exercises. I'm a freaking PT. I tell her what exercises to do. Her solution? Freaking stretches for hypermobility. For some reason, the Hulk dude wanting to cry is hilarious. Bench press and curls are the way to go. Dude must have decided to skip back and leg day. Story 11. My dad is an emergency nurse. He experiences the same thing doctors in the ER do, maybe more so because he's the one in the rooms more often. Anyway, here's a good story from him. I had a patient come in with several pages he printed off the internet. He kind of slammed them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, bloody stool, and fever, among other things. He insisted he had schistosomiasis. He was being a real jerk about it, like we're wasting time since he already knew what he had. So I asked when he got back from Africa, and he said, "Africa? I've never been to Africa. What the hell would I be doing in Africa?" I proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River or other rivers in developing countries like in Southeast Asia. He got pissed off at me because he thought I was being a smart. He got seen and diagnosed with gastroenteritis, the stomach flu, the bloody stool. He had hemorrhoids. He may not have had schisto, but he was certainly swimming in denial. And hemorrhoids. Keep off the spice, bud. Story 12. Dental nurse here. Asked a patient to fill out her medical history and asked her to just tick alongside the company set medical history. Not that intrusive, just medical stuff we as dentists and nurses need to know. And as she stated she was pregnant, I ticked the non-smoker, non-drinker box for her. She said no to all the questions as I went through them. Her previous forms all said she had never smoked or drank. No lie, this woman literally flipped telling me I had no right to do this. I mean, you're pregnant, so you shouldn't smoke or drink, right? So I just get her new form and she ticks that she drinks roughly 10 units a day and smokes 20 a day. I asked her if she does this while pregnant, and she said that she has smoked and drank throughout all her pregnancies. 3 kids under 5, pregnant with another, and they were all healthy. She stated that there was no scientific and medical information on the dangers of it. I literally didn't know what to say. As a dental nurse, all I was able to say was it's really bad for your gums and teeth and general oral health, not the fact that you're damaging your children. As for the children's medical history, all 3 had fetal alcohol syndrome. She was adamant this was untrue and the doctors lied about this. And one had a birth defect which is related somewhat to smoking during pregnancy. Story 13. Not a doctor, but am a medical technologist. There are plenty of I am very smart moments, but this one was recent. Did a finger stick for a patient, ensured the little cut stopped bleeding, then put a band-aid on it. Told her to collect a urine sample for testing. Test came back strongly positive, 4+ reading for blood. She complained to the doctor that there was no way she has blood in her urine, and that the blood from her finger stick must have entered the urine, throwing off her reading. She said it was my fault that I did her blood test before her urine test. They obviously made a mistake. She repeated the test later in the afternoon, still at 4%. Came back a week later, still at 4%. The look on her face when I told her, "Sorry ma'am, your result is still positive," was priceless. Based on all the presented facts, I'm pretty sure it's all your fault even after a week and it's still a 4+. Definitely your fault. Story 14. RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No! No water! He's allergic to water." Well, this is going to be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. I can't make this stuff up. Well, if he was allergic to water and could only drink sweet tea and Sprite, it should have at least been 0 sugar. Story 15. I'm an RN that works with oncology, cancer patients, some of which are on clinical trials. I got a patient and, before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. Normal range is usually between 70 to 100. He got really upset at this point and asked him, "What's wrong? Your labs are within range." And he said, "I need it to be 0. I said, "What? Why would you want your glucose to be 0? He said he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, "I don't know what clinical trial you're trying to get into, but if your blood glucose was 0, you'd be dead or dying." He was not convinced because I'm just a nurse, so I sent a message to his MD asking them to educate their patients better. I hope you loved the video, and if you did, you'll surely enjoy what seems harmless but is incredibly dangerous. I still can't believe Story 5 is a true story. See you on that video.